Heart disease is the #1 killer in America. And tonight you're invited along for a rare, all-access look inside a heart attack.
From the ambulance to the emergency room, we'd like to show you exactly what more than 1 million men and women suffer each year.
Amelia, 2 weeks ago today, I was staked out at St. Joe's Hospital in St. Paul with 6 photojournalists where we connected with a middle-aged man having a heart attack. At 9 a.m., he thought it might be cold air bothering his lungs. By lunchtime, he went to see his doctor.
We have an emergency coming from St. John's. Paging them.
Who's scrubbing?
Code AMI.
They take you out of the ambulance, kind of reminds me on TV. What's running through your head is like, well, what's going on, you know?
Harry Walters is only 49 years old, and he's living the nightmare that strikes roughly 3,300 Americans every day. He's having a heart attack.
What'd you say the nitro's running at?
I don't have any labs unless Bonnie got them.
It's probably good he didn't know at the time that 4 out of 10 heart attack victims don't make it.
1, 2, 3.
Got to the doctor's office, and he did an EKG on me, and all of a sudden he started dropping nitroglycerin under my tongue.
5 milligrams. Perfect.
Those are our labs?
Once you understand what's happening inside a victim's heart, you'll understand why medical personnel scramble. What is a heart attack exactly?
A heart attack, in general, in the way of a coronary heart event, is due to a rupture of a plaque inside of an artery.
Healthy's cardiac cath lab director, Dr. Mark Earhart, says 95% of heart attacks happen this way. You see, plaque is more than just fatty cholesterol buildup inside of arteries. The body sees it as tissue. So when plaque cracks, blood clots form along the rupture, trying to heal it. The resulting clots can then block an already narrowed coronary artery. Heart attack.
Everything past that artery is no longer getting the blood it needs. And we're talking losing hundreds to thousands of muscle cells a minute while that artery is blocked.
0 being no pain, 10 being the worst, where would you rate your pain right now?
Dr. Earhart says about 400,000 people a year die during heart attacks because they insist on getting themselves to the hospital instead of calling for an ambulance.
76-year-old male, difficulty breathing.
911 medical emergency calls in the East Metro are used to dispatch paramedics who were strategically placed at area fire stations. Within seconds, they can have their rescue units on the road and can reach patients feeling symptoms of heart trouble within minutes. When ambulance crews encounter a patient having a definite heart attack, they contact the Healthy's call center in the Midway area of St. Paul, which then initiates its Level 1 program, setting off a flurry of communications from the field to the hospital.
How's your breathing feel?
Back in the field, paramedics are doing more than just chauffeuring patients in. They begin evaluation and treatment immediately. Wiring a patient to a 12-lead heart monitor reveals how well the heart is beating. Thanks to technology, this and other vital information beats the patient to the hospital.
They've already done an EKG over there, so we know where the elevations are and where they think the heart attack is at.
Meaning which heart artery is most likely blocked. In the cath lab, registered nurses prep the procedure room. Supplies they expect to need are laid out and pre-assembled. Radiology and cardiac techs fire up equipment.
Code AMI.
Which brings us back to Terry.
Okay, it's Terrence Walters.
He took 1,300 milligrams of aspirin at home when he was having this chest pressure. He had chest pressure in the midnight.
Listened to somebody so far then.
Is Tommy paging her?
150.
Every step is calculated to save precious minutes. By the time Terry's ambulance arrives, paramedics know they can roll straight in. No stopping in the ER, no registration, no time wasted getting Terry on the cath lab table at St. Joseph's Hospital.
As we take these pictures, I'll have you take a breath. I'll tell you when. Hold your breath for about 6 or 7 seconds, okay?
With the thin tube, the catheter, threaded up to the heart through a leg artery, Dr. Earhart explores the main blood vessels feeding the right and left sides of the heart.
We looked at the left main, LAD and circumflex. Now we'll put in a different catheter.
Little squirts of X-ray dye show up on the fluoroscope as its camera takes pictures from several angles and gives the doctor a clear view of blood flow, or the lack of it.
There it is. There it is.
Half an inch down the right coronary artery, dead end.
It's completely 100% blocked right there.
The back and bottom of Terry's heart walls are starving for oxygen.
There should be x-ray dye following an artery all the way down and around here.
Within a couple of minutes, it is. See the little gray balloon? Inflating it stretches the narrowed spot in the artery, which Dr. Earhart then props open permanently with a wire mesh scaffold called a stent. In the radiology control room, the paramedics who brought Terry in watch in amazement. 28-year veteran Mike Cuppy remembers when clot-dissolving drugs were all doctors had to work with to try to open the arteries, and they didn't always work.
In years past, we used to bring people in, and we just watch them die slowly.
23 minutes after paramedics dropped Terry off, his blocked artery was reopened.
Perfect. Oh, perfect.
It's called door-to-balloon time. The median time at St. Joseph's is 58 minutes, far better than the national goal of 90 minutes.
He's doing great. In fact, you're going to be able to see him.
All of which makes Dr. Earhart's job a lot easier when he faces Terry's worried wife and siblings.
2 days ago, this guy's wandering through the Northwoods deer hunting. He's feeling pretty good. Well, this morning he wakes up and he's feeling not so good. He knows something's wrong, and yet he told me he didn't think he was having a heart attack. Still, he didn't waste any time, got emergency help right away.
Saturday night, I just went walking in the woods. I'll bet you I walked a good 6, 7, 8 miles. And I was sitting there thinking to myself Monday night, boy, if this would have happened out in the woods, I could have been a goner.
There is a lesson to take away here. 2 essential things you have to remember. Terry did them. Call 911 and take a couple of aspirin. Now, Terry had started doing all of the right things. He lost over 25 to 30 pounds since the first of the year, was riding his bike to work, had gotten his cholesterol and blood pressure under control. He had also quit smoking 10 years ago, but family history simply caught up with him. Lucky guy, however, doctors managed to restore his heart function with no permanent damage.
Wow, that's amazing. Now, was it me, but he looked like he was awake through that whole procedure?
He is. It's called conscious sedation. Doctors want to be able to communicate with that patient. They're going to ask him to hold the breath for some of the x-rays and also to tell them if they feel any more chest pain so they know they're working in the right area of the heart. Don't miss anything.
Wow.
Impressive.
Well, thank you. Thank you. That was very interesting.
Learned a lot.
Yeah, definitely. Now, if you have questions about your heart's health, volunteers from Health East are here to help right now. To know more about heart attack warning signs, call 1-800-542-WCCO.